Good afternoon. Today we are going to talk about EHR integration basics. So we will take a look at the different types of interface connections that practices and hospitals can use to connect to the HIE, what that means in terms of the data that they send, and what that means in terms of how they query the HIE and retrieve data. So there are two basic types of interface connections that are the most common. One is HL7 interface, and the other is an XBS.B interface connection. And our HIE will accept either of those interfaces, and it's really determined based off of the EHR vendor's capabilities, which interface that they can do, and our participants, our customers' preference on the type of interface that they would like to use to connect to the HIE. So the first interface connection that we will look at will be the HL7 integration. And so we'll take a look first here at the integration process and what that means for our customers when they are just beginning to connect to our HIE. So the first step in this process is the customer will be assigned a project manager, and that project manager will stay with the customer from the beginning into the very end when if they ever choose to no longer be a customer with the HIE. And so that project manager gets assigned as soon as the customer signs a participation agreement with us. And the first step that project manager will take is they will schedule an introductory call with the customer. And you can see here, this is the first step here in the integration process. And so they will do that. They will reach out within a day of the welcome email going out to the customer. They'll reach out and schedule that call, and it will just be a call between the customer and the project manager. And they'll discuss the customer's needs. Are they interested in just integrating into the HIE? Are they interested in the dashboards, the patient portal? Are they going to be involved with MIPS? And so they'll kind of assess the customer's needs, and they'll send out a little welcome packet that explains the process. We'll talk about the timeline and how long the integration typically will last. And so then the second step will be that the project manager will request that the customer order an interface from the EMR vendor. And so the customer contacts their EMR vendor and says, we'd like an HL7 interface connection to an HIE. Please send us a work order. And that work order will list out the interface type, and it will list out the cost of the interface connection. And so at that point, the customer will be able to assess what those fees will be from the EMR vendor and from our HIE. And the EMR vendor can send, different types of data depending on the EMR vendor. They can send a variety of different types of data. And so the third step then is to have a technical call with the EMR vendor and the customer and the HIE PM to discuss the type of connection, whether it will be over a VPN or if we will install our care agent onto the customer's server. They can do either option. If they install the care agent onto the server, then that means that we are much more able to monitor the connection and to monitor if that connection goes down, if there's different feeds that have gone down, and then we can very quickly contact the customer and the EMR vendor. So we prefer the care agent connection. Also on that technical call, we'll discuss the types of HL7 feeds that the EMR vendor can send. Our HIE can take all of the feeds, and so it really just depends on the EMR vendor's capabilities. There's a variety of HL7 feeds that can be sent, and so they're an ADT feed. Sometimes in that ADT feed, allergies are included, and procedure and diagnosis is included in that ADT. The majority of the time, demographics are included, and insurance information is included. So we'll assess on that technical call what all can be included by the EMR vendor in that ADT. Other types of feeds that can be sent are a medication feed, a lab feed, a notes feed, so that would be like office visit notes, what happened during the visit, and I believe, and then we can do radiology report feeds. So an ADT, meds, labs, notes, radiology reports are the typical feeds that can be sent through HL7. So then the next step is to install and test the either VPN or the care agent connection. So we build that connection in conjunction with the EMR vendor, and then once it's built, we test to make sure that that connection is working. So that's that next step there. That typically doesn't take very long. And then we move them into the in queue for the integration, for the actual integration work. So we need the work order in place, the technical call done, and either the VPN or the care agent installed and tested. And then we'll move on to the actual integration work. And so we'll put them in queue, which means that we make sure all the assessments are done, that they're ready to go, the customer is ready, the customer wants to begin the process. And then we move them into the work in progress. And so we'll notify them that we're actually starting the integration work. The PM will notify them, and we'll notify the EMR vendor. And then the main next step is that the customer or the EMR vendor will start to send their real data into our test environment. So this is just a test environment. It's not the production environment. Only the project managers, the integration engineers on our side can actually see this data. And so this is where a lot of the work will happen. There's a lot of back and forth. We'll analyze the data. We'll make sure that it's adhering to our specifications. There's oftentimes a lot of back and forth between our integration engineer and the EMR vendor at this stage. And then once we think that that data is looking good, we move into user acceptance testing. So this is when the project manager contacts the customer and will set up what we call UAT, user acceptance testing, with the customer. This will be a webinar where we will show the customer what their data is looking like in UAT and have them pull up a couple of different patients, and we'll compare the patients that are in the test environment with what is in the customer's electronic medical record and make sure that that data matches. And if all goes well, if it matches, if the customer doesn't notice any issues, then we have them sign a user acceptance testing form, which is basically just saying, yes, we agree, we've looked at this data, these are the different types of data that we'll be sending. We'll list out the different feeds such as labs and meds and ADPs. The customer will sign it, send it back to us, and then we will pick a go-live date. So we'll contact the customer and the EMR vendor and say this data looks good, we're ready to move into production. And so then we'll take a look at, this is just kind of another view of what that looks like, of kind of how that workflow happens, and if we have any troubleshooting calls that we need to have, and just kind of how it flows back and forth. And then one other piece that I want to show is the time frame and the timeline and what this looks like, so that we can convey this to our customers. So you can see with HL7 here, the first section of this project plan is really the steps that need to get in place, that need to occur in order for the integration to happen. So those first steps between the introductory call and connectivity being established can typically take about 3 weeks or so. And then the next section is really that integration and the testing of the data and the analyzing of the data and that back and forth with the EMR vendor. And you can see here that that takes typically about 11 weeks. So in general, we like to say that these HL7 integrations might take up to 5 months. And generally, I'd say anywhere between 3 to 5 months. Oftentimes, those integrations will take longer when we haven't worked with the EMR vendor that often, or when the EMR vendor isn't as advanced as some of the other larger EMR vendors. So 3 to 5 months is typically what that integration will look like. The other important thing to note is with HL7 integrations, this means that these interfaces are unidirectional, meaning that the customer is sending data into the HIE, but in order to retrieve data, in order to query the HIE, the customer will need to log on to the HIE provider portal to view that data. So HL7 integrations are not bidirectional. The customer must log into the HIE provider portal to view the data. So to send the data with HL7, it's quite easy. The data gets sent in almost near real time. The trigger is when the patient chart is signed off on or locked down. There's a couple of different terms that different EMR vendors use, but as soon as that chart is locked down or signed off on, then that data, there's a trigger in place where that data gets sent automatically to the HIE. There's nothing really that the practice or the hospital needs to do to get that data sent over. So the next piece that we'll look at is the XDS integration and what that workflow looks like. It's a little bit different, and it's typically takes less time than the HL7. And so I have XCA up here also, but we'll talk about XDS. XCA isn't as common of an integration, and so we'll focus on XDS today. So XDS is where customers will really have that bidirectional integration, where they can query the HIE from within their EMR. Now, not all EMR vendors that can do an XDS interface can provide a bidirectional interface, but most EMRs can. And so this is really the type of integration or interface that we encourage our customers to pursue if their EMR vendor can do it, if their EMR vendor has the capabilities, because this gives them that bidirectional functionality. And so you can see the workflow here. It stays a little bit the same in the beginning. We have the introductory call. We send out an IHE assessment form to the practice and to the EMR vendor for them to fill out. It just explains the XDS.B process, and it's a double check to make sure that the EMR vendor can do that type of integration. And so then we'll have a technical call with the EMR vendor. The interface will get ordered, and then the project goes into queue. It goes into awaiting approval and awaiting scheduling. You can see then it becomes a work in progress. The EMR vendor will configure the client system, and then they'll start sending transactions into our test environment. We'll make sure that those transactions are happening and that we're receiving them. And then we have user acceptance testing, just like we do with HL7, where we'll actually view the document with the customer. We'll have the customer sign off, and then we'll move into prod. I'm going to switch here to another view of what this looks like as we talk this through. So this goes a little bit more quickly. With XDS.B, what's being transmitted is really a static document that has, in one concise document, it will have procedure and diagnosis, it will have the date of the visit, it will have demographics and allergies, it will have labs in there, it will have medications, immunizations in there. It will also typically have vitals in there, which is different from an HL7 integration. XDS.B can contain vitals, whereas HL7 does not contain vitals. And so it's oftentimes more concise, more complete. It has more data in it in XDS.B integration. So this means that they are sending CCDs, continuity of care documents, into the HIE. And then when they query the HIE from within their EMR, they pull back CCDs or consolidated CCDs into their EMR. And oftentimes, these EMR vendors are capable of parsing out the data from a CCD. So a customer can query the exchange, pull the CCD into their EMR, and then really pick and choose which pieces of that CCD, which pieces of data the customer wants to include in their patient's chart. So do they want to include medications? Do they want to include, penicillin but not aspirin? So they can pick and choose and parse that data out. So now that we've gone over this document, let's take a look at the timeline for the XDS.B. The timeline, as I said, is a little bit shorter than the timeline for HL7. And you can see here for the first section where it's really this pre-integration, it takes about, I'd say about a week. And then the actual integration work takes about 8 weeks. So this is if all goes well, if the customers and the EMR vendor is responding quickly, we don't have any bumps. This type of integration is usually a shorter time frame than HL7. So the next piece that I want to take a look at is the actual health information exchange in the provider portal. And I want to point out the differences in HL7 data and XDS.D data. So we will take a look at a test patient, and we'll see both types of data in here and just, how that looks different in the health information exchange. So the first piece of data that we'll look at, again, we're in the provider portal. We are not in a patient's, a customer's EMR. We're in the provider portal. And so we'll log in first and we'll take a look at the HL7 data that can be sent and what that looks like in the provider portal. And as that's spinning, I want to point out a few things in the provider portal that that the customer can use. So we've got a little icon over here. This is the print icon. So they can print these documents off if they want to, and they could save them as a PDF and attach them to the patient's chart. There's also a couple of buttons up here. We've got a help button here, and if they were to click on that, that would pull up the training document for the provider. It just is a really concise, detailed document of how to query for patients and understanding the HIE. And then we've got a clear button, which clears all the data off, and then a lockout and a lock button, which you always want to use if you're going to step away from the provider portal. So we do have data on this patient. So I'm going to click on the underlying name here for SPC test patient. And one of the important things when you're querying for a patient from within the provider portal is to always make sure that you click on the extended search. When you click on extended search, this will pull up CCD data. It will pull up XDS.D data. So it's very, very important to click on this button so that you can see both HL7 and XDS. So to look at the HL7 data, the first piece I'm going to click on is history. And we're going to click on visits. And you can see here all the different tabs. You can see procedure and diagnosis and immunization and allergy and med. That's all HL7 data. Those are the different categories that we talked about. So for visit history, you can see the visit date and time. You can see here when you see Via Christi, you can see the different hospital or facility that the patient showed up at. And you can typically see the provider and the location, whether it was the ER or whether it was an inpatient. This is test data, so not all of these fields are filled out correctly or properly or fully. You can also oftentimes see complaints. So what was the chief complaint of that patient when they entered into the facility? The next piece we're going to look at is procedure and diagnosis. So this is what procedure and diagnosis will look like in HL7 data for in the provider portal. Procedure and diagnosis is sent to the HIE in the ADT feed. So here are the diagnoses, and then here are the procedures. And typically in a patient, you would get all of their history here. So this is just a test patient, so we're looking at one event, but you could have years worth of data here on a patient. And then we will accept immunizations in HL7 if the practice wants to send us immunizations. And typically you would see a long history of immunizations here. And then allergies. One of the things that's important to talk to potential customers about is now that they are sharing information in an HIE, it's very important to fill out all of the data. The data that we receive is only as good as the data that customer is only as good as how fully the customer completes that data, fills out that data. So if the customer doesn't fill in severity and reaction of an allergy, we won't have that information. We won't display that information. So now that the data is being shared, it's really important to really be thoughtful on how complete that data is that gets sent to the HIE. The next piece that we'll look at is medications. And so we take active medications, and if we have a start and stop date, you can see here we display the start date. And again, this data isn't fully filled out because it's test patient data, but typically we would have all of these columns filled out. So the route and the dosage and how often the patient's supposed to take the medication. And then if there's a stop date, I'm going to click on medication history here. If there's a stop date, we'll display the data in medication history. So you can see the start and stop date here. This is really important data for us to have so that providers that are sharing patients can get a complete history of their patient. The final piece that we'll look at for HL7 data is labs. So I clicked on clinical history, and now I'm clicking on labs. And this is what labs will look like for HL7 data. And you can see here, if you hover over, you can get a little bit more information about the patient. If you see something in red, that means that the lab result is out of range. And then you can switch views on here to take a look at this in just a different way. And so you can see which ones are out of range, the ones that are highlighted in red. The next piece that we'll look at then is what XDS.B data looks like. So I'm going to click on clinical history. And so as I said, XDS.B data gets sent to us in the form of CCDs, continuity of care documents. And so here is a CCD that was sent to us. And we'll take a look at this one from Beloit Medical Center. And so you can see here this is from Beloit, and we can see that their EMR vendor is Allscripts. We can see here the date that this document was sent. So we'll let that kind of think a little bit and pull in that document. Also in this section, as that's thinking, under clinical history, you can see a variety of different documents. For instance, clinical communication that might be going back and forth between two providers. We can see extracts of data. We can see labs. We can see operation notes. But here's the CCD. And so at the top of the CCD is really demographics, and it lists who sent this CCD, which provider, which practice. It lists the provider's name. And then we've got the table of contents. And again, this is a test patient, so it's not fully populated, but typically all of these sections would be populated. We've got the procedures, immunizations, social history, results, which would be the labs and the vitals. And then here are the different encounters that patient had. So that's XDS.B data. And then the next piece that we'll talk about is how this data affects the the other components of our product. So the next piece we'll look at is the dashboard demo. I'm going to log in. This is just a demo site, so this is just test data. And so when you think about the integrations and the type of data that gets sent, if a practice cannot send procedures and diagnosis, then that of course is going to affect their dashboard data and how well we can populate their dashboard data. So if they're not sending procedures and diagnosis, well, really diagnosis, then we're going to have difficulty populating their high-risk dashboard and their chronic conditions, because we need to know, have they been diagnosed with any of these conditions, of these chronic conditions. And so you can see how that would affect. Then we'll look back here. Let's go back to high risk. Let's go back to ED visits. So ED visits is going to tell us how often they've shown up at a facility, at an ER. And so if we are not getting ER data, or if we aren't getting it on a regular basis, then we wouldn't know how often they're showing up at ED. So this is really important visit data that we would collect. So we'll go back home here and we'll take a look at, let's take a look at readmissions. And again, this is just kind of basic information that we would want to get from a hospital. Another piece that's important here is ensuring that we get the date of discharge so that we can track, how often they visited the hospital. And again, it's important to track the diagnoses because we will note whether, they got readmitted for stroke, whether they got readmitted and they had hip and knee replacement, COPD. So that's the importance of receiving the diagnosis. The next piece we'll look at is the utilization tile. And so what this really tells us is we're tracking patients for a particular provider, and it tells us how often they've showed up at the ED. Of those ED visits, how many of those patients were admitted into inpatient? And then of those visits, here in this middle tile, how many of those patients had an office visit? How many of them had an office visit in the rolling 12 months? So this is a really important tool to track what's happening with these patients once they show up in the ED. And so it's important to get, the hospital data and the office visit data, the practice data, so that we can track all sorts of pieces related to this, to the patient. And then the last piece is really the quality metrics. Again, this is the importance of getting procedures and diagnosis. If we're not getting those pieces, it makes it very, very difficult to track quality metrics for them. So you can see in this drop down here all of the metrics that we're tracking. If we're not getting immunization data, then we're not going to know whether the patient received an influenza vaccination, for example. And so you can see those different screenings that we're tracking. Okay, so that concludes really the webinar for today, just explaining the different types of integration, the two basic types, which is HL7 and XBS.B, the types of data that are contained in those integrations, and the importance of receiving the different, the impact that receiving those different types of data will have downstream for the dashboards for that customer, for aggregating the data for other customers, and just the importance of really having clean, well thought out, well populated data and how that will impact the dashboards and health information exchange and care coordination. So that concludes our webinar for today. Thank you.